Hemorrhoids, commonly known as piles, refer to swollen veins located in the anus and lower rectum, resembling varicose veins. These may manifest internally within the rectum, internal hemorrhoids, or externally beneath the skin surrounding the anus. External hemorrhoids. In the United States, hemorrhoids affect 10.4 million individuals, constituting 4.4% of the general population. Annually, approximately 1 million new cases are diagnosed. However, only 1/3 of the 10.4 million affected individuals seek treatment each year. Do you know there are some great people in the United States who suffer from this disease? Among these people are George Bett, who was a professional baseball player, Jimmy Carter, who was President of the United States from 1977 to 1981, Ernest Hemingway, who was a world traveler. In this video, we delve into the types, causes, symptoms, prevention, and treatment of hemorrhoids. There are two types of hemorrhoids. Internal hemorrhoids. These hemorrhoids form within the rectum, which is the section of the large intestine leading to the anus, and are typically not visible without a medical examination. Internal hemorrhoids typically do not cause pain, although they may bleed without discomfort. Occasionally, internal hemorrhoids may protrude through the anus, a condition known as prolapse. In such instances, they typically retract into the rectum spontaneously or can be manually reinserted. External hemorrhoids. Hemorrhoids developing beneath the skin surrounding the outer area of the anus are particularly discomforting, often causing itchiness, pain, and a sensation of lumps. In cases where a blood clot forms within these external hemorrhoids, it leads to a condition known as a thrombosed hemorrhoid, characterized by intense and persistent pain. While some clots may naturally dissolve, unresolved cases may require medical intervention. Removal of the clot by a doctor is most effective within 72 hours of its formation. Causes of hemorrhoids. Numerous conditions and behaviors are believed to contribute to the development of hemorrhoids. These include chronic constipation or diarrhea, excessive straining during bowel movements, prolonged periods of sitting on the toilet. Straining, constipation, and prolonged sitting can all impede blood flow in the area, leading to a condition where blood doesn't circulate as efficiently, known as pooling, within the blood vessels, ultimately resulting in hemorrhoids. Factors that increase the risk of hemorrhoids include: some factors increase the risk of hemorrhoids. Inadequate dietary fiber intake, overweight or obese, which can exert pressure on the hemorrhoidal tissue, aging, which weakens the connective tissue in the rectum and anus, potentially causing hemorrhoids to protrude, pregnancy, during which the growing fetus exerts pressure on the abdomen, enlarging the veins in the rectum and anus. However, this issue typically resolves after childbirth. Symptoms of hemorrhoids. Discovering blood in your toilet bowl following a bowel movement can be distressing, and it's a primary indicator of hemorrhoids. Additional symptoms may include bright red blood on toilet paper or in the stool post-bowel movement, itching in the anal region, pain in the anal area, particularly when seated, discomfort during bowel movements, presence of one or more firm, tender lumps around the anus. Should you encounter any of these symptoms associated with hemorrhoids, it's advisable to refrain from excessive straining, rubbing, or aggressive cleaning around the anal area, as these actions can exacerbate irritation and itching and potentially lead to further bleeding. Instead, opt for gentle patting to dry the area rather than wiping. Prevention of hemorrhoids. There are 3 methods of prevention from hemorrhoids. Method number 1. The guidelines for men under 50 to consume at least 34 grams of fiber a day are provided by the USDA's Dietary Guidelines for Americans. For women in the same age group, the recommendation is 25 grams of fiber per day. Gradually add fiber to avoid bloating. Berries, avocados, pears, broccoli, artichokes, whole grains, legumes, nuts, and seeds are fiber-rich. Consider supplements if needed. Limit low-fiber foods like cheese and processed foods if experiencing chronic constipation and hemorrhoids. Method number 2. Daily water intake recommendations vary and are individual specific. However, the Institute of Medicine of the National Academies suggests adequate intake levels of 2.7 liters, 91 ounces, for women and around 3.7 liters, 125 ounces, for men. This hydration can be obtained from both beverages and food, though it's important to note that caffeinated beverages and alcohol can have a dehydrating effect and should not be included when aiming to meet these intake goals. Method number 3. Regular exercise, particularly engaging in 20 to 30 minutes of moderate aerobic activity daily, can promote regular bowel movements. Additionally, maintaining a consistent exercise regimen may aid in weight loss, potentially reducing factors contributing to the development of hemorrhoids. Treatment for hemorrhoids. The majority of hemorrhoids can be managed at home or through straightforward medical procedures performed in a doctor's office, contingent upon the type of hemorrhoid and the extent of your symptoms. At-home hemorrhoid treatment and remedies. Preventing constipation is essential for treating hemorrhoids. Incorporating dietary and lifestyle adjustments, particularly increasing fiber intake, can alleviate hemorrhoid symptoms. Fiber supplements like psyllium, egg, metamucil, and stool softeners such as methylcellulose, egg citrusol, can aid in preventing constipation. However, it's advisable to avoid laxatives as they may induce diarrhea and exacerbate hemorrhoid symptoms. To alleviate hemorrhoid discomfort, several self-care measures can be taken at home. 1. Take sitz baths, a warm, shallow bath specifically targeting the affected area. 2. Kits are available at most drugstores. 3. Apply an ice pack to reduce swelling. 4. Refrain from straining during bowel movements. 5. Ensure proper cleansing of the anus after each bowel movement. Hemorrhoid treatment in a doctor's office, with or without surgery. For persistent hemorrhoids, medical procedures may be necessary. External hemorrhoids can be surgically removed under local anesthesia in a doctor's office. Office procedures for internal hemorrhoids include rubber band ligation, sclerotherapy, and infrared coagulation, which help shrink hemorrhoids by cutting off their blood supply. For larger or prolapsed hemorrhoids, a hemorrhoidectomy may be required, although it's seldom needed. During a hemorrhoidectomy, the hemorrhoid and surrounding tissue are surgically removed under anesthesia, with stitches used to close the incision. Another option is stapled hemorrhoidopexy, which aims to reduce postoperative pain by stapling the hemorrhoidal tissue in place. And there you have it: types, causes, symptoms, prevention, and treatment of hemorrhoids. If you find the video interesting, please do not forget to subscribe, like, and share my channel. Thanks for watching the video. Till then, stay happy and healthy.